Let's grab a couple people here and see what they have to say.
Didn't Clinton do
We're having a little discussion here, are we?
Apparently I'm getting yelled at.
Why are you getting yelled at?
Apparently he thinks that I'm supporting Bush for some reason, even though I'm clearly not.
Yeah. I want to know, where were these people 8 years ago? 8 years ago, when we went to war, no weapons of mass destruction. When the infrastructure was being screwed up, was being unresponsive, nobody was out here. You're not even giving the guy who's in power, you're not even giving him 2 years.
Well, let me ask you a question. Where were you when it came to the war?
I was out here marching.
Okay, and so now he's out marching against the war, right?
No, it's not marching against the war.
No?
He's marching against the health bill. He's marching against the bill of free health.
Okay, so
that a lot of countries got already.
Okay, let me just ask you, are you opposing the war now that a Democrat is in the White House?
I was opposed to war when the Democrat was in. I was opposed, but the Democrat didn't bring us to war.
I understand that, but he's the president now, and he just increased the number of troops in Afghanistan.
Wait a minute, he's caught a mess that he has to clean up. Okay, now let's not talk like he brought us into the situation.
I didn't say that, but he did increase the number of troops.
He increased the number of troops in Afghanistan. He downsized the troops in Iraq.
Following George Bush's withdrawal plan.
Following George Bush's withdrawal plan, the plan was put in by the Pentagon, not George Bush.
All right. Okay, so you're here opposing the health. Are you a member of the Tea Party movement? Or?
I'm not a party member of the Tea Party movement. I support individual rights is the key issue. I don't think that health care is a right. I don't think that you can, by forcing all the rest of America to purchase insurance, I don't think that is correct.
But you realize that now, if I don't have insurance and I go to the hospital, they by law have to treat me, and therefore you who are paying for insurance, your premiums are going up anyway, and so therefore you're subsidizing it as it is. Wouldn't it be better for me, if I don't have insurance, to be given some kind of insurance so I can have some kind of preventative health care?
I disagree. The problem is you have to understand what the issue is with insurance. What is insurance? Insurance is you're supposed to be, guarding against something catastrophic. Insurance isn't just a way to get health care. I mean, that's the problem. Health care is overutilized right now, and that's the problem. Is that everybody can just go to try to get health care anytime they want. That's why our costs keep rising. Every time they have some sort of government bill, whether it's Medicare or this recent one, you could see that the expected cost rising. And it's because of government interference. It's because it's now overutilized, and it's simple supply and demand. If you increase the demand, we can't afford it because of all the government interference and the waste. If we didn't have that system, that's overutilization, right? What are you comparing it to? When did we have a free market in healthcare? Basically, as soon as insurance was created in the 1930s, they started regulating it. We haven't had a truly free exchange with healthcare and insurance.
But if you didn't regulate healthcare, then they'd go even further toward practicing medicine without a license. I mean, your doctor can write you a prescription, and your medical insurance can deny you that based on their tables, right? So,
what's the problem with that, though? Because what's the problem with an insurance company denying you if you have?
You might die as a result.
You're confusing the issue. Now, just because, if, for example, remember, this is insurance. So let's say I have a home and it sets on fire. Can I just go purchase insurance in the free market at the same price as someone who doesn't have a home that's on fire? It doesn't make any sense. That's what pre-existing conditions are. Your house is on fire. Why does everybody else have to insure me because my house is on fire? Why do I have a right to everyone else's money to put out my house fire, whatever it is?
So healthcare is based on
implies risk. There's no risk if you already have it. That's not insurance. That's having someone pay for your health care.
All right, but as a result of the insurance system, the way health care is funded in the United States, what happens is if you are unemployed or underemployed you cannot afford health insurance. I mean, I've got health insurance. I work for a good company that provides me with health insurance. Maybe my neighbor works for a company that doesn't provide health insurance. So I should benefit from health insurance, and he should not.
You're forcing doctors to accept less payment. You're forcing people to pay more money, and for what? Because you claim that somebody's entitled to something.
And you don't believe everybody's entitled to health insurance. It should be based on income. Based on the income.
Nobody is entitled to it. You pay your own. Personal.
If I can't afford it, I just suffer. You won't get fired. Here's my card.
I appreciate it.
Here's my card. You guys are good sports. Thank you very much. Good luck to you. All right. So, thank you guys.
Get out of this liberal pocket.
Okay. So the thing about this Paul Hedora, who's my cameraman today, the thing about this that I find kind of interesting, Paul, is that I'm not going to suggest that this is reflective of everybody here or a majority of people here, but the thing that I find kind of interesting about this, Paul, is that people who are concerned about broad assumptions made about them. Today, we're making broad assumptions about other people.
I agree.
So what does that say about the discourse here in the United States over these issues?
Nothing new. It's all the same. It's been going on for decades, and it will continue to go on.
Okay, that's probably the most astute thing that we've heard today. So we're ready to wrap this up. Boaz, if there are any questions for me, I'm happy to entertain them.
Well, Gary, I mean, there was so much noise there. The first thing that concerned me is that we thought that you were going to get beat up. I mean, that's what it looked like.
No. This is just very passionate discourse, between people, and that's what this country is all about. No, I'm glad you asked that question because I did not feel in fear for my safety at all during this little discussion that we were having. So, if people were concerned about that, I want to take that out of their minds.
Yeah.
That was not in here.
But the problem is, everybody else here in the virtual auditorium were fearing for your safety. We thought that you were going to get trampled.
No, I wasn't going to get trampled on. Paul here, who's about half my height, was going to kick their butts if they trampled on me. Don't worry about it.
Well, one thing's for sure, Gary. I'll tell you, a lot emotions are running high there. I mean, you have a huge gap of a difference of opinion when it comes to this healthcare reform.
That's right.
And I mean, people are just up in arms about it.
Right. And the thing is, I was trying to find some common ground. I recognize that some of my questions were perceived as antagonistic. I understand that. But I did try to find some common ground. I couldn't bring them back around to anything that has a semblance of compromise. And that's what really disturbs me about how some people who are so passionate about these issues on both sides seem to be unable to perhaps even listen to the other side. I mean, when we walked up there were some, they were shouting at each other. The people who were against health care and the people who were for health care, and they weren't really listening to one another, I don't believe.
Well, with all the noise there, it was hard to tell what was going on when that band started to play.